Everybody hi. When flu, COVID-19, RSV and other respiratory viruses surge together, your overall health level, including vitamin D status, body weight and control of chronic diseases, becomes as important as avoiding exposure. A strong baseline makes infections less likely to become severe. Build your health reserve before infection. Your risk of being hospitalized with a respiratory infection is high if you are older, have obesity, live with chronic heart or lung disease, or have a low income that limits access to care and healthy food. These factors cannot all be changed quickly, but you can steadily improve your reserve by prioritizing sleep, regular physical activity adapted to your abilities, smoking cessation, and good control of conditions such as hypertension, diabetes, and chronic obstructive pulmonary disease. Even modest weight loss for people with obesity, better diet quality, and more movement can reduce inflammation and improve how your body responds to infections. Vitamin D, known your level and correct deficits. Large observational data show that people with the lowest vitamin D levels in their blood have about 1/3 higher risk of being hospitalized for respiratory tract infections than those with the highest levels. At the same time, the relationship appears similar across races and ethnicities, which suggests that severe deficiency is a general risk signal not limited to one group. Vitamin D is important for immune function, but taking high doses blindly is not the answer. The key step is to know whether you are deficient. If you have risk factors for low vitamin D, little sun exposure, living at northern latitude, dark skin, obesity, old age, malabsorption, or kidney disease, ask your clinicians whether you should check your level with a blood test. If it is low, your doctor can recommend it a safe supplementation plan, dose and duration, and decide whether follow-up testing is needed. Do not self-prescribe megadoses because excessive vitamin D can be harmful for kidneys and calcium balance. For people without a major deficiency, using a standard moderate daily dose as part of a vitamin or according to local guidelines can be reasonable, but it should complement, not replace, vaccines and other measures. Vaccines and medicines protecting your weak spots. For most adults and children from 6 months and of age, seasonal flu and updated COVID-19 vaccines are the most powerful tools to prevent severe diseases, even if they do not stop every infection. They are especially important for older adults, people with obesity, heart or lung disease, diabetes, kidney disease, and those taking medicines that suppress immunity, because these conditions make viral infection more dangerous. In some countries, RSV vaccines for older adults and pregnancy time protection for infants are now available. Ask a clinician if you or your baby quality. If you do become ill and you are in a high risk group, contact a healthcare professional within the first 1-2 of symptoms, because antiviral drugs for flu and COVID-19 work best when started early and can lower the chance of hospitalization. Everyday habits to reduce exposure. Even with good vitamin D and vaccination, limiting your exposure still matters. Stay home from work, schools or social events when you are having fever, strong cough, or feel acutely unwell, especially in the first several days of illness. Improve ventilation by briefly opening windows several times a day, using kitchen and bathroom fans, or placing a HEPA air cleaner in the main living area or bedroom of sick person. in crowded indoor places during peaks, public transport, clinics, large shops. Wearing a well-fitting medical mask or respirator is a smart choice, especially if you or your someone you live with you is at high risk. Regular hand washing with soap or using alcohol hands rub after public spaces and before eating is simple but effective, particularly for children who often spread viruses by touching surfaces and then their faces. Protecting vulnerable family members. Think of your households as one health system. If one person gets sick, the whole system is stressed. Make a simple plan in advance. If someone falls ill, they use a separate bedroom if possible. Keep distance from high-risk relatives and wear a mask in shared spaces for about a week from symptom onset. Use separate dishes and towels for the sick person and clean high-touch surfaces, handles, switches, phones, toilet flushes daily during illness. When visiting frail older adults, people with cancer or transplants, or newborns, be strict. Do not visit if you have any cold-like symptoms, even if you think it is just allergies. During high virus weeks, consider shorter visits, better ventilation, or outdoor meetings when weather allows. Combined with good baseline health, appropriate vitamin D status, and up-to-date vaccination, these simple behaviors significantly reduce the chance that a winter virus turns into a serious life-threatening event. Thanks for likes and sharing.